Hello and welcome to a brand new podcast. This is the UKMFA, UK Medical Freedom Alliance. My name's Ian Humphreys, and this is the first, as I say, of a series of podcasts that we're going to be broadcasting out to the UK and I guess so the world, because we're also going to be on the general platforms that reach the rest of the world. There's been a saying that without health, life is not life. And I think we go further to say that without freedom, life is not life either. So it wouldn't be correct to do the very first podcast without the CEO of UKMFA with us. So I'm very, very happy and pleased to produce and to present, of course, Dr. Elizabeth Evans. Hi, Liz.
Hi, Ian. Great to be here.
Thank you for making it an easy journey into this new world that we've just created for ourselves. So thank you very much for that. So we managed to have a little chat beforehand, and I think what we wanted to try and get across to people maybe right at the start is how UKMFA started, and also a little bit about you, because you are really the core to our organisation. You started it, you kicked it off. And it'd just be really great to hear a little bit about your background, your medical background, your opinion on what used to be medical ethics and maybe what has now changed. And yes, some more about the organisation and the campaigns that we have been and are going to be involved in and are currently running. And then I guess in subsequent podcasts we will start to focus on particular issues, and then we can tackle those in much more depth. So if you don't mind, I'll just hand over to you just for a brief introduction.
Okay, so I'll introduce myself first, and then maybe you can lead me through each of those different things, because there was a lot of questions there. So I qualified as a doctor in 1996 and worked for a few years in general medicine. So I did my my house jobs, my SHO jobs, and was just training to be a GP registrar. I had some ill health, so I had to have a couple of years off work, and through that got better, not with conventional medicine, but actually using nutritional approaches, other complementary health techniques, which gave me a completely different view of health. I realized that there was more to medicine than just what I'd been taught at medical school. There was a whole load of other things which I could do to actually help my body to heal and repair, which was very exciting. So I went back into medicine for a little bit longer, and then had some children, had 4 children, so took some time out of work. And when I came back, I retrained to do complementary medicine. And for the last 12 years or so, I've been helping people to work with their own bodies to actually support their healing and repair. Because I think with chronic illnesses, particularly, Western medicine can suppress symptoms, but doesn't do a lot to address underlying health. But actually, there's a lot of untapped potential there for people to really work on their own health using dietary approaches and environmental choices, working on their emotions, all these other things which actually can create good health and reduce the need to rely on pharmaceutical medicines, which obviously have a place, but probably are now overused. We are in a very, very heavily medicated society. So that's my background, which meant that when the pandemic struck, I was outside of the medical system, but obviously with a huge interest in medicine and knowledge about medicine. And because I have this real sort of trust in my own body to know how to get better and heal and repair and to fight illnesses and viruses, I was never, ever scared of the virus. And I just made sure I stocked up on all the sort of essential vitamins and things that I would need to support my immune system and my family's immune system should we get unwell. But right at the beginning, I said to my family, you don't need to be scared. It's fine. Let's not don't buy into the fear. I said, we'll just, take reasonable measures to support our health and we should be fine. But none of us are at high risk. So yes, so the pandemic unveiled, and very quickly I was really horrified by what I was seeing because, I was medically trained. I knew what was normal and what was transpiring, and the way the medical profession were reacting and proceeding was very, very the antithesis of what I would have expected. So I was really worried. Particularly the fact that the health service seemed to almost shut down. Right, as soon as lockdown happened, people were being told not to go to their doctors if they had COVID or if they were unwell, and it felt like doctors had become scared of their patients, which to me was just shocking. I couldn't understand. Part of the job of being a doctor was that you go in and you treat people and you help people no matter what the circumstance. You don't really give much thought beyond basic precautions to your own health. When I was a house officer, it was sort of quite early on in the HIV crisis, where there was no real treatment. It was considered a deadly illness, but we were taking blood every day and knew that if you got a needle stick injury, you could possibly end up with a life-threatening illness, but it didn't stop you like getting on with your job. So it was accepted that risk was part of the job. And then I saw somebody I know had COVID in that first 2 or 3 weeks of the lockdown, and basically was denied any sort of medical care until he was so sick that he couldn't breathe, which was sort of 2 weeks into the illness, and was taken away but then put on a ventilator for another 16 days. His wife never ever got to see him again. He sadly died, and she never got to see his body. And this was a couple who'd been married for 50 years. And for those 16 days, she was alone in her house, and her relatives felt unable to visit her or support her or in that time. And she was alone. And I just knew at that stage something was very wrong, because it felt to me like there were red lines that should never be crossed, no matter what. And one is separating loved ones from each other if they're sick or dying. One is not being able to go and just support your loved ones. One was not giving medical treatment, the GP not visiting when this friend of mine was getting sicker. So all of those things were massive ethical red flags, and that's what got me started on this interest in what was going on with medical ethics.
I can tell that it's very emotional for you, even though you're talking about it now, and it makes an awful lot of sense that it is. And I went through a similar experience myself, even from a patient and having a mother in a care home kind of point of view, different scenario, but the end result is the same. So when you were studying medicine originally, we didn't have a world like that, did we? Did we ever have reactions to any illness whatsoever in that regard, with lockdowns, with health services being unavailable? Because I can't remember anything like that in my lifetime.
I don't think that's ever happened, to be fair, not in this country anyway, and not in the Western world. And when I was doing my junior doctor jobs, every year it was the health service was under massive pressure from the flu. We would be treating patients in corridors. There was operations being cancelled, and this was normal, and we just got on with it. There was no kind of panic. It was in the press a little bit, but we got on with it and looked after people and got through the winter. So yeah, I think the way that we responded was so like out of what I knew to be normal, rational, and kind of ethical, or even sort of common sense response. It didn't make any sense to me. I was like, what's going on? And also I couldn't understand why the doctors weren't just refusing to go along with it, because to me, I would not have felt able to refuse to go and visit someone who was sick, for example.
Sure.
So when her family were not coming to visit her, when she was waiting, at home with her husband on a ventilator in hospital, I said, I'll come and give you a hug, because that's the right thing to do. This is about right and wrong. This is not about,
Sure.
we can't live in fear. You could be run over by a bus just walking out onto the road. We've got to, keep our humanity. And I think that was what was the shocking thing. We lost our humanity and we just strayed. We cut so many red lines and we just strayed right over them. And then we were into the unknown, because suddenly, it seemed like anything went, and it just got more and more dehumanized and more kind of distorted, this sort of reality that people were living in, and people got more and more frightened and isolated and atomized.
Yeah. So this separation between families, friends, carers, parents, children, is that what drove you to form the UKMFA? Was that the core of it, or the lack of humanity that you were noticing?
I think, well, initially, so what I started to do, obviously, I was aware that there was something strange going on. So I started to really look into the data, and I was, reading all the papers, looking at the country data, listening to podcasts. And over sort of 3 or 4 months, really felt like there was something, we're not doing the right thing here. So, when the 3 weeks passed, and then the 6 weeks passed, and I'm thinking, this can't work. And also, it was so obvious to me that you can't just shut down a society and a healthcare system and not have massive damage in the long term, just economically, and, that businesses were going to fail, and people's mental health and education. So even at that stage in sort of April, May of 2020, I could see that the cure was going to be so much worse than the disease. And where was the risk benefit analysis? And there just didn't seem to be one. So I sort of, I always say I almost did a degree in COVID over those few months and over the summer. And by the end of it, I've been posting on social media and trying to say to people, come on, look at this data from Sweden. And, what about this? And what about all these other different things that I was picking up, but nobody was interested. So I remember going on a walk with my husband, and he said, so what are you going to do with all this knowledge that you've got? And I said, I don't know. He said, you're going to join one of these organizations. I've been to a few protests by them. And then the next day I saw a post on Facebook from a doctor who was Anna Forbes, who had said, really like to do something about this, from a medical perspective. So, and that was the trigger where I was like, yes, that's what we need to do. We need to start talking about medical ethics, because that was the gap that was not being filled. We had Molly and her team at Us For Them doing an amazing job with that. We had Save Our Rights, who were doing the protest, and it felt like I wanted to do something to try to galvanize doctors and sort of put them back in touch with their ethical sort of principles.
So up to that point, there was no one in your professional or even non-professional circle, if you like, that was actually understanding where you were. Is that true?
Yeah, and again, as I say, I was outside the medical profession, but when I saw, doctors in the community that I knew, that none of them were kind of, they didn't seem to be seeing it or framing it from an ethical perspective. And I felt like I was more and more convinced that no matter what the data was, really, that the ethics were what we have to do all of our policies on.
Right.
It shouldn't just be about, just because you can do something doesn't mean you should do something. Yes. So, and also then the mask mandates had come in, which I felt were an infringement of bodily autonomy, and also didn't really follow the principles of informed consent, which is that any medical intervention should be completely voluntary and uncoerced. So if people want to wear one, that's absolutely fine. I would have supported people to wear one. I think that's not a problem if they knew the risks and benefits but wanted to do that. But people should not be mandated to do that. So I thought at that point, and then the testing had come in, that we needed to start putting together some resources to help people to understand what their legal and ethical rights were in terms of informed consent. And also I was starting to think, I know where this is going. I was also watching all the vaccine trials happening and the rhetoric and the way this was being presented as the solution to the pandemic. And again, that made no sense to me, because I was like, no, because pandemics are usually over within a year or so. People are immune. People, we weren't still fighting the Spanish flu in, the 1920s. It was past, that was old news. So a vaccine to me never seemed like a rational, even if you could make a safe one, that was not going to be a rational way of dealing with it, because the problem would be over. So then I started to think, I reckon we're heading to vaccine mandates and to a sort of health passport, digital passport system. And I'd been following a lot of the work of the Children's Health Defence in America, the High Wire, who were highlighting and getting interviews with medical freedom groups out there. And I realised that the UK had no medical freedom movement at all. So there was no health choice movement, because we'd never needed one.
No.
So that was when I thought, right, we should get our ducks in a row now, so we're not reacting when the vaccine mandates come. We'll start to try to get people together to fight this before it happens. And thank goodness we did. So it was in October 2020 that Anna and I basically put out a call on social media for doctors, lawyers, scientists, health professionals, and we got probably about between 50 and 100 responses. We formed a sort of a team and really had to hit the ground running, because we thought we'd just start with masks, which would be an easy one to write. And then very quickly it was obvious the vaccines were going to be rolled out even sooner than we expected.
So these were early campaigns, were they? So what did those campaigns look like?
So really, the first thing we ended up doing by the time we got our team together was we had to get together a letter, which we wanted to get out to MHRA, JCVI, Hancock, Prime Minister, other people, to say why the vaccine should not be authorised. Because it was so fast-tracked suddenly that autumn that it was like, we've got to, get everything we know onto paper and get it out there before they authorise it. And we were racing against time. So we worked with some lawyers, and there was a whole team of us kind of putting this letter together, looking at it from an ethical perspective, the science that was available, the sort of medical side, the legal side. And we got a 14-page fully referenced letter out on, I think it was something like the 28th or 23rd of November 2020, about a week before the MHRA authorised it.
Yeah.
But it's there. It was published as an open letter. It went to all these bodies and figures, the decision makers. And it's really interesting if you go back and read it now, because everything we said pretty much has come to pass.
Yes.
So, and I feel like since then we've been trying to create a paper trail of evidence to say, look, this was available at the time. We told these people, they had sight of this, and it was all stuff that was in the public domain.
Sure.
Published literature, newspapers, statements from people. It was all sort of documented evidence. It wasn't hard. We were just a group of volunteers who were working hard to find it, but it was there.
Yes.
So that was our first big project, which we obviously didn't manage to stop the rollout. And at the time, we, to be a so-called anti-vaxxer, which you would be labelled as if you question the vaccine, was so rare. Nobody wanted to touch it.
No.
And I really didn't want to, I was thinking, I can't believe I don't want to start on this. We'll just, talk about masks and why it's unethical to make people wear masks. And, I didn't want to go down the vaccine route straight away, but we were kind of forced into it. So we've really led the way, actually, I would say, on the sort of the evidence-based vaccine sort of counter narrative since. So we then put out a letter in February 2021, when it was very obvious that with the rollouts of the vaccine across the world was a massive spike in deaths in care homes. and in the elderly. And that was coming out in the population data and also in news reports from various countries reporting these big outbreaks of COVID in these homes and deaths following the rollout. And again, a lot of people didn't want to touch it. So we got out a letter with all the data on there to saying this needs to be looked into as a matter of urgency. And it went to the same sort of figures, the health minister, MHRA. And then I could see, although the rhetoric at the time was this is only for adults, I thought, no, they're not going to stop until they've got it into everybody. So we put out a letter at the end of February 2021 stating all the reasons why children should never be given the COVID jabs. And of course, we weren't able to stop that. But again, they were on notice and it was all laid out. For all of our letters have been we've tried to keep them unemotional and just very scientifically and factually based with full references so that people can look at the evidence themselves.
And how are you funding all of this? Because there's a lot of work and time and I guess money spent as well if you're going to be creating these things. So how are you doing that?
So we've been operating on a shoestring since the start. So we set up a website and we put a donation button. So we've had donations from members of the public, more in the hundreds a month, sure. Rarely over £1,000 a month. And our costs we've kept very low because up to, I don't know, only a few months ago, nobody was being paid for anything. So we purely relied on volunteers, apart from paying for the website services, accountancy services, because obviously the minute you make money, you've got to then account for it. So, but yeah, it's been through goodwill and volunteer work mainly. But we do recognise now at this point, the worst of the emergency is over, we are going to need a really good medical health freedom movement in the UK going forward. And we really are the only ones focusing on this. America has many, many different groups. Most states have more than one organisation. So we do want to try to become a more, I hesitate to use the word sustainable, but it's a good word in this case. We want to be sustainable in the long term and be able to pay people, not a lot of money, but, something for their work so that we can continue to advocate for bodily autonomy, for medical ethics, to be able to speak in the public, to be able to lobby decision makers on this. We're facing much wider threats to it now, with all the WHO stuff and other agendas that are coming in. So this problem is not going away. So yeah, we are keen to sort of raise our profile, raise some, again, keep it just public funded, from members of the public supporting us.
And of course, if people want to contribute, they can see our website address on the very screen they're looking at right now, ukmedfreedom.org, everybody, ukmedfreedom.org. If you could visit there, you'll find different ways that you can contribute. That would be lovely. Come and join our alliance.
Yeah, and I'd also encourage people to sign up to our newsletter, which we put out probably about once a month, and also with any new campaigns or calls to action. So we won't be spamming your email box. You might get one or two a month. Sometimes a bit fewer, depending how much time we've got. But yeah, that's a way to keep in touch with what's going on as well. And
we'll make a few more of these videos too, if people prefer to get their content that way. We can reach people in lots of different ways, so that's another way of doing it. So that's great. So it's been quite a journey, isn't it? It's over a relatively short period of time, though it feels like a lifetime probably, but it's only been a couple of years or so. And the organisation is well established, and as you say, is the UK's leader in this. And that's been quite obvious because of the invitations you've been getting to appear on other people's podcasts and and being able to put your point of view and going to speak at various events, which I know is always very, very well received. Okay, wow. So there's so much I know that we could talk about. The campaigns in particular, there's been quite a few. Which would you say are the most prevalent right now, and which ones do you want to put the most energy into at this moment?
So at the moment, so a lot of our campaigns, I would say, have been quite collaborative. I'll just go through the ones we've had. The main ones have been the time to pause was a big one that we did on children's vaccines, where in 2021 when we were trying to stop the authorization and rollout to the lower age groups, because it just kept rolling out. And we worked with groups like HEART, the Children's COVID Vaccine Advisory Council, and other groups to try to Safer to Wait, we're a big group in that, to try to get awareness up. We did a letter delivery to Downing Street, and actually got to speak on GB News as a result of that to Neil Oliver. So that was really good publicity. And I think we would argue that that campaign, particularly in the way it raised public awareness, actually was a great success, because in the I don't remember which age group it is, the under 11s, there was only a very small take up, and the 11 to 15 was about 11% in the end. So I think it worked at the point of consent. So it didn't stop the rollout, but parents were not giving their consent to the vaccine. So we can have success. We followed that with an NHS Back to Normal campaign, when all the policies, the masking, the visitor restrictions were basically just continuing, ad nauseum, and there seemed to be no end point. So we had a big campaign on that and led that with a lot of other groups helping out. So our current campaign is on the Stop the WHO, which is a sort of an international collaboration. There's many groups all across the world who are fighting this power grab. The WHO, through various instruments, they've produced a One Health policy agenda, sort of ideology, where they want to link animal, human, and environmental health all together, and all policies flow from that. So that means that climate change can be considered a health issue, which then could create, potential health emergencies, fakes as they're known, per public health event of international concern. And then they're trying to do various legal instruments to strengthen their position. So you've got the international health regulations, which are already international law. There are proposed amendments, which are of great concern, which really start to move to a global governance system over public health. The Director General, in one of the amendments that's currently proposed, we don't know whether it will be accepted, would be able to call single-handedly a public health emergency. And then they're seeking to make their advice binding as opposed to non-binding, which then requires all the member states who are in this IHR. So if you don't opt out, you are in it by default. So there's no national vote on it. When these are passed next year, whichever ones are passed, we will then have a very short period of time to actually opt out. If we don't opt out, this is international law. So I've written an article about that, which is, I think it's on our website now. And then the pandemic treaty, which is less of a sort of a sovereignty threat. It's more about the creation of a big global architecture of a pandemic industry and financial sort of incentives. James Roguski describes it as a sort of a venture capital document. And then the UN has also got some common health emergency platform or something. So there's various things going on which we need to start to make our members of parliament aware of and to actually push back against, because the last pandemic or the last emergency was bad enough when we were just following advice. But imagine what a position we would be in if a fake is called and our government introduced lockdowns and all the other measures. Who would we protest to if this is just their obligation under international law and they have no choice? We would no longer be able to write letters to our MPs, protest on the streets, because the government ministers would say, it's out of our hands.
Yeah, which puts them in a more comfortable position, probably from their point of view, because they can wipe their hands of it and say, well, it's nothing to do with us. But even right now, though, there seems to be very little democratic input from from the people into this in any event, and it seems that whoever's controlling it on behalf of the UK actually isn't even part of the government. They are a separate entity, as I understand it.
Yeah, we've got a delegate there. I'm not even sure who it is. Each country has a delegate, but then a lot of the meetings happen behind closed doors. You know, documents just keep getting changed all the time. It's very hard to keep up with what's going on. So yeah, and I think we're not stakeholders. It's for the delegates and the stakeholders, who tend to be big foundations, pharmaceutical companies, big tech, all these people who have an interest, but the public aren't considered to be stakeholders, so don't have a say in all of these negotiations and meetings to draw up these new legal instruments.
Yeah, it's interesting how a lot of these large organisations seem to be made up exactly the same way, whether it be the World Health Organization or others are very similar. I know we mustn't go down that route probably, but it's still very interesting. Yeah.
Yeah. So anyway, so on our website we have so in our campaigns tab, there's all of our campaigns are there, but the one at the top is Stop the WHO. If you just go to the page, you can read articles, resources, news, and then we've also got calls to action, and we'll put up things as they come out, not just from ourselves, but from other organisations. So I think Together are doing an event this week on Wednesday, which, and we would promote each other's events. I think
Yes.
Francis Hoare is going to speak about it. So I would really encourage people to just get really educated on this, and then use resources to educate other people, and particularly members of Parliament. Use the democracy we have.
Sure. And this is our challenge right now, isn't it? It's reaching the people that aren't already within our little sound box, I suppose we call it, our echo chamber, because it's all the people that are outside that we need to try and reach, which I'm hoping that these broadcasts will reach them. We will start pushing them out to people that haven't really heard this kind of information before, this kind of perspective, because they've not been exposed to it. So I would encourage anyone again that's watching this to please share it with your friends and relatives, and sit down and watch, and then start to learn, start to do the terrible phrase, do your own research, but actually it really is that, because what you're being told isn't necessarily what the facts are. So yes, great. Okay. I don't know what else you'd like to cover today. I mean, we've already been speaking for half an hour, which goes very, very quickly, and I know we could talk forever. Is there anything that you'd like to add right now to this particular broadcast?
I would just really encourage people to go to our website, have a look through our resources. We've got some really good presentations in our media page. We've got lots of open letters on different topics, which are all categorized. Have a look at our campaigns and sign up to our newsletter. And if you can afford to, please do donate to us. We just, the smallest amount, £1 a week or £5 a month, will do so much to help us to actually do more and really establish ourselves as a voice that gets really listened to, and maybe we can get into the mainstream media, which would be fantastic.
Lovely. I think just to finish off this, and I think we will do separate videos about certain definitions of words and phrases that come out within the medical world that people might gloss over because they're not really understanding what they mean. But in particular, I think that the taglines that we use in UKMFA are the word like the bodily autonomy is one, and informed consent is another. Could you just quickly just give a quick idea of what your definitions of each of those, so that people understand what we mean?
Yeah. So, well, the whole of medical ethics sort of started with the Hippocratic Oath, which is first do no harm, and what it does is it recognises that whenever you do any sort of medical intervention, whether it's a test, a treatment, there is always the risk of harm. So what you must make sure is that the benefits to that individual outweigh the potential harms. So, because the worst thing that you could do as a doctor is cause more harm than benefit. And then what else came into the Hippocratic Oath was that confidentiality is really important, because otherwise you need to have trust in this relationship. And medical ethics exists because within the doctor-patient relationship, there is such an imbalance of power. You've got the patient who's in a very vulnerable situation, sharing very intimate details, being seen in a very intimate way, maybe, touched in an intimate way. The doctor has a lot of power in that situation, and is party to maybe some things that, that person has never told anyone else or never shown anyone else. So there's a potential for abuse and then, for atrocities to occur. So medical ethics are the framework within that the doctor has to operate to protect the patient's vulnerability and to keep them safe from being harmed by the doctor. So the idea of informed consent is that any treatment undertaken by a patient has to be first explained fully by a clinician, all of the benefits and potential risks, and also the alternatives to treatment must be shared with them. And then the patient must be given enough time to consider and ask questions and decide completely voluntarily, without any coercion from either the doctor or their family or society. And that's even sort of listed in the NHS constitution. It recognises that coercion may not just come from the medical practitioner, but could come from outside. Yeah. It's not legally valid in consent if you are coerced. So you have to be completely free to say yes or no. So that is what legally valid informed consent is.
Great. Thank you very much. I think that explains it beautifully. Thank you. Well, Liz, thanks ever so much for your time. You've made it very easy to do our first podcast. It's really, really lovely. And we'll do our next one very, very soon. And thanks ever so much.
Right. Thank you so much. Thank you for putting this together. It's it's very professional.
Shucks. I'll speak to you soon. Take care.
Okay, bye.